Welcome to a new healthy prevention and disease prevention video presented by
Angie, Mantilla, Silvia, Jaimes, Paula, Fletcher,
and me, Mariana Moreno.
Today we will talk about various aspects of dental caries and especially a program to prevent it in Lebrija, Santander.
Let's start by learning about caries according to the World Health Organization. Dental caries can be defined as a pathological process localized of external origin which begins after eruption and terminates at softening of the hard tissues of the teeth. Formation of a cavity.
According to Mayo Clinic, cavities are caused by combination of factors including bacteria in the mouth frequent, snaking, sugary drinks, and poor tooth cleaning.
This is characterized by a series of chemicals and microbiological reasons that cause the destruction of the tooth. The destruction is result of action of acids produced by bacteria in environment of dental clay.
Clinically, caries is characterized by color change, loss of translucency, and descalcification of affected tissues. As the process progresses, the tissues are destroyed and cavities are formed.
There are multiple types of cavities. Among there are cavities associated with eating habits. This is the most precocious and aggressive type of a caries with a typical presentation in external part of the superior incisors, followed by the affection of the molars.
Cavity in pits and fissure, deep and irregular grooves that present on milk, molars, and permanent, due to the stagnation of food, especially soft food. On this chewing surface, cleaning is difficult, favoring the entry of bacteria to the tooth.
Interdental caries. This is a later type of caries. Science it occurs on the space between the molars as close. They are lesion that appears between the teeth associated with a lack of cleaning of the space between the teeth.
Cavities due to enamel hypoplasia. Enamel defects favor the entry of bacteria into the dentin and increase the risk of caries in a child. These defects are frequent in canines and second primary molars.
This disease affects both the crown and the root of the tooth, and the absence of tension causes the loss of the dental organ. It is also a focus on infection for the body and the people who associate with those who are infected.
On the other hand, risk factors for dental caries including poor oral hygiene, dental crowding, and social factor, low level of intrusion, and knowledge in health education.
Poor oral hygiene is a very decisive factor in appearance of dental caries. Science is in below of a greater accumulation of dentobacteria, plaque, which reduce the diffusion coefficients of the acid formed by fermenting microorganisms, facilitate the mutilations, and process increase the risk of caries.
Like carrier diet, any sugar consumed frequently can cause tooth decay. Sugars between milk and sticky food are discouraged. The greater the frequency of snaking or drinking between meals, the greater the risk of tooth decay.
One of the most common causes of this oral disease in Lebrija is due to the foods they consume in this municipality, such as pineapple, tamales, chocolate, oil cakes, and one of its most representative foods in the Easter season as are the rosquetes and torrijas that are baked good.
At Christmas, it is also common to consume sweets such as el rebaño, coronillas, polvorones, and cortadillos. Since the main component of these sweets are pumpkins, sugars, almonds, and flour.
The prevention measures useful process in the prophylaxis of caries are present, which can be grouped in 4 seasons. Use the fluoride F, oral hygiene, diabetic measures, and treatment of active lesion. We use of sealants.
Use of fluoride. When consumed in optical quantities, it increases dental mineralization and bone density, reduces the risk and prevalence of dental caries, and helps remineralization of the enamel at all times of life.
First, brushing. The technique should be simple for parents and children. It is recommended to clean on lateral dental surface, lingual and vestibular, with circular movements, and the masticatory surface with anterior-posterior movements.
The brushing technique should be explained to the child and parents. Up to the adolescent, with a thorough brushing, most of the techniques are effective. If alignment problems occur, teeth are missing, dentures are missing, or the child doesn't know how to brush, special techniques should be recommended. Finally, the use of the small heat brush with synthetic bristles are round tips should be recommended to avoid chewing in hurry if the child uses it for self.
Second one, the toothpaste. The use of appropriate toothpaste increases the benefits of the brushing. The use of fluoride toothpaste is the most recommended method for prevention of dental caries. The clinical recommendation for use the fluoride toothpaste for children 6 years of age and older is twice daily, with a toothpaste contain 1450 ppm F and the amount of 1 to 2 centimeters of the brush.
In dietary measures, make sure that the carbohydrates are in dilute or aqueous for minimum retention, avoiding sugars with a sticky or adhesive texture. Avoid using candies as gift between meals. Sugared soft drinks between meals are not insignificant source of sugars.
In summary, sugars and sugary drinks or soft drinks should be restricted in childhood to meals to achieve great caries prevention, especially avoiding their intake between meals and at bedtime.
Treatment of active lesions should be carried out in the temporary and permanent dentation as it reduces bacterial colonization and the risk of destruction to health teeth. This is a specialized measure reserved for the stomatologist.
Buccal exploration presence of taser, abscess, gingivitis, cavities, crossbite, anteriobite, diastema, and frenulum. Malocclusions and crowding. The child will be derived the dentist when it presents displays some cavities in the definite places of fourth or more in primary dentition. Also, the hypoclasms and enamels and the malocclusions will be derived.
Prophylaxis of caries and periodontal disease. Only if you belong to a CD risk group will F supplements be given orally, depending on the F content of the water, whether it is for public consumption or bottled water. Daily 0.05% FNA or weekly 0.2% mouthwashes recommended for use at the school. A strategy that ensures its application. It is necessary to check that the child does the mouthwash well for 1 minute and that he or she does not swallow the liquid. In general, from the age of 6 in the following 30 minutes, he should not inhale anything.
Gels and varnishes of fluoride always applied by a specialist with variable periodonticide depending on the risks of caries. To brushing after meals and at the bedtime with a toothpaste containing 14-15 ppm of fluoride and the amount of 1-2 centimeters on the brush.
This is the bibliography on which we based to make this video.
We thought was a video that you liked and that about all you learned as much as we did. Thank you very much for your attention and see